the years, MS TeamWorks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
Hi, my name is Mona Bostic. I am a registered dietitian with a private practice in Greensboro, North Carolina. I began my nutrition career working in an acute care inpatient setting, specifically with the oncology population. Helping people to meet their nutrition needs while navigating cancer treatments was a job that I loved and I felt honored to be able to do. But living with multiple sclerosis myself, I began to consider the impact that long hours and a long commute was having on my own health. Deciding to leave a job that I loved was difficult, but private practice has allowed me to continue the nutrition conversation with people in a more in-depth way. It allows more time to educate, problem solve, and support people as they make health-promoting changes. Through my own private practice, as well as consulting that I do, I'm very fortunate to meet, work, and talk with hundreds of people living with multiple sclerosis every year. In the private practice setting, I am better able to help people address the unique challenges that they are facing. This is very important because MS is such an individualized disease and everyone experiences it differently. So there is no one-size-fits-all recommendation. How does nutrition impact multiple sclerosis? The unfortunate thing about that very frequently asked question is that depending on who you ask, you may receive different responses. Dr. Google makes a lot of promises on the internet using vague verbs like heal, beat, reverse, or sometimes even cure multiple sclerosis with a collection of specific supplements or arbitrary food rules that tell you to eat copious amounts of one food while completely restricting other foods. But the truth is that despite what Dr. Google is saying, eating well is not defined differently because we have multiple sclerosis, or at least not based on any currently available research. However, it is especially important to be as healthy as possible within the setting of a MS diagnosis. This is because of the role that comorbid health conditions have on the health outcomes and health-related quality of life of people living with multiple sclerosis. Having MS and a comorbid health condition, including things like diabetes, heart disease, hypertension, and others, especially if these conditions are not well controlled, may lead more quickly to disability and a lower quality of life. Unlike what you may have read on the internet, food choices cannot make multiple sclerosis go away, but along with other health-promoting behaviors, food choices and food-related habits play an important role in living well and managing common MS-related symptoms like fatigue, bowel irregularities, and cognitive issues. I would strongly encourage people living with multiple sclerosis to consider how their current food choices and behaviors are contributing to their overall health. How's your blood sugar? How's your blood pressure, your blood fats? Are there different choices that you can make each day to promote your health? Food choice is an important part of managing these conditions, along with other health-promoting behaviors, and I encourage everyone to make sure that these conventional clinical nutrition concerns have been addressed before integrating alternative or complementary modalities. Many common multiple sclerosis symptoms can impact one's nutritional health and can make eating well with multiple sclerosis a little more challenging. Fatigue is a big one, and it sneaks into just about everything. Mobility and activity limitations can make shopping and meal preparation difficult. It's also important to know that we require fewer calories as we age and are less active. In other words, decreased activity can lead to decreased calorie expenditure, which may over time contribute to excess weight. Depression and anxiety can, along with some medications, contribute to appetite changes or maladaptive, otherwise known as disordered eating behaviors. Bladder incontinence can lead to avoiding fluids to prevent accidents, but doing that can lead to dehydration, which just makes fatigue worse. This is just one example of how many of these symptoms and their impact on nutrition build on each other. And in some cases, swallowing difficulties may require texture modifications to the foods and beverages that you consume to prevent weight loss and nutrient deficiencies. Many people deal with more than just one symptom and in varying degrees from day to day. And each of these MS symptoms can lead to malnutrition if not addressed. To prevent this, it's very important to speak with your healthcare team and make them aware of any challenges that you might be experiencing. Some of the most common pitfalls of a diet, and I air quote diet, it starts with the word itself. Diet is a 4-letter word that implies something with a beginning and an end. Diets usually begin on a Monday, often in January, and end when you fall off of a wagon of some kind, or even worse, are unfaithful, which means you cheated. 30-day diets or detoxes do not provide any lasting benefit. Successful dietary interventions must be built around forever changes to result in the outcome you are seeking. Recently, it seems as though diet has become a verb rather than a noun, which used to be synonymous with your eating pattern. It is usually something you do over and over. Yo-yo dieting, meaning losing weight and then regaining it, is actually very bad for your health. Worse, in fact, than simply carrying extra weight. As it relates to multiple sclerosis specifically, the biggest pitfall I see is unrealistic expectations. Again, heal, beat, reverse, cure, things of that sort. Another pitfall is losing sight of the forest for the trees. In other words, trying to micromanage the disease process itself with very specific interventions like a supplement or a dietary restriction, while not actually doing everything possible to just eat a balanced diet, exercise, manage stress, and other health-promoting behaviors that are associated with improved health outcomes. Many of the MS-specific protocols and regimens encourage restricting large swaths of food, many of which provide important nutrients, which may contribute to additional symptoms or worse, malnutrition. They often then encourage the consumption of supplements to replace these nutrients. But the truth is, the human body prefers to get nutrients from food, and food is so much less expensive. Remember, just because a regimen or a protocol or a diet has lots of rules about good foods, bad foods, just because it's hard to follow and it's expensive and it's confusing, doesn't mean it's good for you. I'm frequently asked about resources that clinicians can use to discuss nutrition with MS patients. An important resource to consider is the patient's medical record. Consider their comorbid health conditions. Optimizing the management of these conditions will help our patients live better with multiple sclerosis. Refer patients with comorbid health conditions and/or questions about nutrition to a registered dietitian. Optimizing management of these conditions will help our patients live better with MS. And as a bonus, the patient will have a trusted resource to refer to in the future should any nutrition challenges arise. Another valuable resource to consider is the Determine checklist. The answers to the very brief screener-type questionnaire will help providers to see if there are any nutrition concerns lurking beneath the surface. It would help to expand the nutrition conversation beyond weight and BMI, which is currently where most nutrition questions gravitate. Social determinants of health and food literacy play a large role in how and what people eat. Providing a handout encouraging weight loss or recommending a specific diet does not consider the environment in which the patient lives, shops, and eats. It does not gauge their understanding of the material, and it does not help people implement these recommendations. The way I define success with patients varies, and this is because everyone is different. But when someone has a deeper understanding of how their food choices and food-related behaviors impact their health, and you see a light bulb go off, then that is success. This understanding empowers them to make health-promoting choices. But knowledge, like a handout, is just the first step. When I can help people turn knowing into doing, I consider that a success. For example, getting a HbA1c value to within a normal range so that a surgery can proceed is an excellent outcome. This patient will still have multiple sclerosis, but their quality of life is improved because of the improved mobility that the surgery was able to provide. Helping people understand that they don't have to eat in a completely different way from their family and friends is a success. Eating in a different way from everyone around you is difficult, it's expensive, it's exhausting, and it's isolating. And multiple sclerosis is isolating enough. After taking time to understand someone's unique and specific challenges, helping them to develop a realistic and sustainable path forward is what makes my day. The most important thing to know about success in my profession is that it is never cookie cutter and one size never fits all. If I could impart just one nugget of wisdom with this video, it would be to reinforce the fact that eating well is not different because of multiple sclerosis. But living with multiple sclerosis makes it especially important that we do eat well. Nutrition is a vital part of health. Many see it as something that falls under the wellness domain or the wellness umbrella. But it's important to remember that before nutrition was co-opted by Dr. Google and the wellness industrial complex, it was a clinical practice, and it still is. Registered dietitians are clinical practitioners specifically trained to break the science of nutrition into plain language and help people implement health behavior changes in their very unique to them environments. In other words, registered dietitians provide education and then help people turn knowing into doing. This is important because it is by doing that we change our habits. Because comorbidities are so impactful on health outcomes in multiple sclerosis, I really encourage patients to meet with a dietitian when they are diagnosed to ascertain a baseline level of understanding and detect if there are any current issues, as well as to provide the patient with a resource for providing trusted, credible guidance moving forward in their life with multiple sclerosis.